According to the Center for Disease Control and Prevention, the CDC, nearly 120,000 Staphylococcus aureus bloodstream infections and 20,000 associated deaths occurred in the United States in 2017. After years of progress, the rate of decline of MRSA bloodstream infections has slowed. The most deadly of these is methicillin-resistant Staphylococcus aureus, or MRSA, due to difficulty in treatment. MRSA is caused by a mutation in the Staphylococcus aureus bacteria that used to be susceptible to the beta-lactam ring on certain antibiotics. The effects can range from localized skin infections to systemic bloodstream infections, leading to death, and can make hospitals a very dangerous place to acquire these infections. The impact has become a worldwide epidemic in certain disease populations and demographics. The solutions are to take extra precautions like screening hospital staff for the infection, hand washing, and calling for a moratorium on more confined animal feeding operations, called CAFOs for short. While not everyone is at the same risk level, there is no vaccine for MRSA, so no one is immune. Staph aureus has historically been susceptible to antibiotics in the penicillin or cephalosporin classes, commonly known collectively as methicillin, due to their beta-lactam ring structure. So I'm going to show you what the beta-lactam ring structure looks like. It's in the red. In their chemical makeup, according to Karinchi Gurusamy et al. In the 60s and 70s, scientists in Europe noted that these common antibiotics in hospitals were no longer effective in treating this common infection due to antibiotic resistance from mutated bacteria known as MRSA, according to Qibin Zhao et al. In the 1990s, it was even noted in Japan that a commonly used antibiotic to treat MRSA, called vancomycin, was also proven ineffective on the MRSA, meaning only one or two classes of antibiotics were left to attempt treatment of the disease, according to Washington Wynn. Nevertheless, vancomycin otherwise remains a treatment of choice in most cases. According to WebMD, MRSA infections can appear as a small red bump, pimple, or boil. The area may be tender, swollen, or warm to the touch. Most of these infections are mild, but they can change, becoming deeper and more serious. Here's a picture of what MRSA infection looks like. They show it right up next to a spider bite, so you can see the difference. The spider bite is on the left side, and the MRSA infection with the pus is on the right side. According to Mayo Clinic, most MRSA infections occur in people who've been in hospitals or other healthcare settings, such as nursing homes and dialysis centers. When it occurs in these settings, it's known as healthcare-associated MRSA, or HA-MRSA. HA-MRSA infections typically are associated with invasive procedures or devices such as surgeries, intravenous tubing, or artificial joints. Another type of MRSA infection has occurred in the wider community among healthy people. This form, community-associated MRSA, or CA-MRSA, often begins as a painful skin boil. It's spread by skin-to-skin contact. At-risk populations include groups such as high school wrestlers, healthcare workers, and people who live in crowded conditions. According to Frontline, a PBS documentary special, there is a positive association between locations with confined animal feeding operations, called CAFOs, and the locations of MRSA cases in the community. So let's take a look.
And when they compared that data with the location of pig farms in the area, a pattern started to emerge.
This is the location of where all of the people with MRSA infections live. Each red dot is a person that had a MRSA infection. So these are all their home addresses.
Right.
So, what I can show you here is the location of the swine operations in this region. Each of these barns represents a large confined animal feeding operation.
So let's look at this next one.
Yeah, so let me show this to you.
So what is this?
So there's some nice overlap you'll see between where the MRSA cases are and where these large swine farms are. You can see that there's some people with these infections living very close to animal feeding operations. And this is the only study that's really been done in the United States that's looked at rural areas and MRSA infection.
According to Mayo Clinic, to prevent hospital-acquired MRSA, HA-MRSA, in the hospital, people who are infected or colonized with MRSA often are placed in contact precautions as a measure to prevent spread of MRSA. Visitors and healthcare workers caring for people in isolation may be required to wear protective garments and must follow strict hand hygiene procedures. Contaminated surfaces and laundry items should be properly disinfected. Also, according to Mayo Clinic, in order to prevent community-acquired MRSA, it's important for everyone to wash your hands for at least 15 seconds and carry hand sanitizer of at least 62% alcohol. Keep wounds covered, since pus can contain MRSA. Shower after athletic games or practices and don't share towels. Also, don't share razors, clothing, or athletic equipment. Sanitize linens and don't inject illicit drugs. According to the Fence Post, an agricultural publication, due to the risk that CAFOs pose, the Public Health Association suggests a moratorium on any new CAFOs being built to prevent the spread of disease through manure. The animals in CAFOs are often treated prophylactically with antibiotics since they are in such crowded spaces. And this is one of the main reasons for antibiotic resistance, according to Glenn and Barrison et al., who found a positive association between the two. Scientists are doing everything they can to fight MRSA, including looking at how it starts through overuse of antibiotics, who is at risk, how it spreads through hospitals, care centers, or even communities in close proximity to CAFOs, development of new antibiotics that can eradicate the disease in affected patients, as well as looking at some naturally derived chemicals that show promise, development of safety practices and precautions to avoid further spread in facilities, and finding alternatives to CAFOs in both as farmers and consumers. As most scientists or doctors will tell patients and laypersons, it is important to only use antibiotics when appropriately prescribed for bacterial infections and not for viruses, to finish the entire course of said antibiotics, and to notify your doctor if you feel another infection is beginning due to antibiotic resistance, according to WebMD. If you are a healthcare worker, it is also very important to practice proper hand washing and not transfer disease from patient to patient, keeping patients who do have the disease isolated from others. We can also try to buy meat and dairy from organic farmers who do not confine their animals in tight spaces. Together, we can all be part of the solution to prevent the spread of MRSA. Thank you.